For part one of the upper extremity adjusting, we're going to do Charrette's protocol. The indicator for Charrette's protocol is the thumb and little finger opposition test, or looking for the indentation on the dorsum of the wrist. To adjust the wrist, first adjust the scaphoid, the triquetrum, the lunate, the distal radius and ulna, carpometacarpal, carpal spread, distal row distraction, trapezoid, capitate, lateral hamate, medial hamate. Then the indicator for Dr. Charrette's elbow. For the radius, feel for spongy or abrupt stop where it's spongy, cross fiber, and adjust in the direction of the sponginess. For Dr. Charrette's elbow indicator on the ulna, cross fiber medially on the medial epicondyle, and if there's an ouch, adjust. Then do the indicator for anterior humerus. With the fist in the air, push arm toward the feet. If it's weak, then adjust. Then post check. For AC, find the AC joint, see if it is springy. If it's not springy, adjust superior to inferior. Then do trigger points: subclavian, mid-scap, teres, levator scap, anterior deltoid, posterior deltoid, anterior medial proximal humerus, and posterior medial proximal humerus. Then subscap. Then do subscapulothoracic mobilization. Now do sternoclavicular mobilization. Now do superior humerus. The indicator, feel for springy, and if it's not springy, adjust by pushing S to I on the area of restriction. Then levator scapula tendon. This is part 2, Heron's protocol. Starting with the elbow, do a tricep muscle test with the wrist straight. This should be strong before proceeding to the next tests. Then demonstrate a tricep muscle test with wrist flexed. This should be weak. If this is weak, demonstrate a tricep muscle test with therapy localization on the medial and lateral epicondyle of the humerus. The side that is strong shows the area of restriction. Demonstrate an adjustment for a posterior medial subluxation. Then demonstrate an adjustment for a posterior lateral subluxation. Post-check with the tricep muscle test with wrist flexed, and it should be strong. Then do tricep muscle test with wrist extended to test the extensors. This should be weak before proceeding to the next test. The next test is brachioradialis muscle test. If it is strong, do a posterolateral slip adjustment. If the muscle test is weak, do an anteromedial stick-it adjustment. Then post-check. For hair and shoulder protocol, you're going to assess the anterior inferior aspect of the humerus. First, do a muscle test at less than 45 degrees. If this is weak, adjust. Then demonstrate an anterior inferior humerus muscle test at greater than 45 degrees. If this is weak, then adjust. Then for the acromioclavicular joint, do the coracobrachialis muscle test. Then adjust. And post-check. For the sternoclavicular joint, do the pec major clavicular muscle test. Then adjust. For the posterior humerus, do the teres major muscle test. Then adjust and post-check.